All right, going to make a motion that we come out of recess into closed session. Is there a second? All's in favor? Any opposed? All For the record. Scott, do you want to, you were going to question her.
Yeah, so I looked through it closely. You know, there's a lot of inaccuracies and intentional or maybe non-intentional in our application. And I think without talk to her, I would make a motion that but
Second.
My licensure and accept the recommendation of the,
Yeah, the respiratory care committee.
Second.
All those in favor? So we had Dr. Dilt's motion, Dr. Root second. All those in favor? Any opposed? Okay. I think this first one's half in person, half, I think. Are they're all here, or?
oh, I don't know about the boards. I mean, if they take 3 years, they finish 3 years of residency, equivalent. But they can take, but they can apply for permanent licensure. Oh, yeah, sorry. Yes.
We're in open session, right? Dr. Yu, can you hear me? Dr. Yu, can you hear me?
Yes, I can hear you.
Okay.
Can you hear me?
Yes. My name is Dr. Wright. Welcome to the South Carolina Medical Board. We know that you're applying for an academic license, and we have one of our board members, Dr. Chow, is going to ask you some questions.
All right, sounds good. Nice to meet you all.
Good morning.
Do we
Can
need to
you
do
hear
an
me
oath?
well?
Yes, I can hear you.
Oh, excuse me. Before we start, can you turn your attention towards the court reporter? You can see her in the corner and follow her instructions. Anyone that's going to testify.
Good morning. This is the court reporter. I will swear you in. I need to get both of your names for the record. Doctor, I obviously have yours as you're on the agenda, and joining you is who, please?
Okay. Dr. At ATZ, but I'm not sure if he's already
Bear with us just a moment.
We already started with her.
Oh,
All right, again, Dr. Yu and anyone else that's going to testify in Dr. Hughes' behalf, please turn your attention to the court reporter and follow their instructions.
Dr. Atz, do you have a camera that you could turn on by any chance?
Let me look at that. I think I do.
Okay, perfect.
Here we go.
Very good. If each of you would raise your right hands for me, I'll swear you in at this time. That's for Dr. Atz and Dr. Yu, please. Raise your right hand, please. Do you solemnly swear or affirm under penalty of perjury to tell the truth and nothing but the truth, so help you God?
I do.
thank you.
Thank you. Can you mute that?
All right. We're good? All right, Dr. Chow?
Good morning. Can you both hear me well?
I can.
Yes.
Good. Doctor, can you tell us, start from the beginning, tell us about your medical education credential and progress into where you are today?
Yes, so I did my medical school in the Philippines, in the University of the Philippines College of Medicine. And after graduation, I went to a rural area in the Philippines to serve as a primary health care physician for about a year, and then went into pediatrics training, residency training at the Philippine General Hospital. And then after graduation, it was the pandemic, so I was a hospitalist in the Philippines for a year in 2021 in a pediatric wing of an infectious disease hospital, and then And then I luckily got into the Masters of Public Health program of the Yale School of Public Health, and did that from 2022 to 2023. And while I was there, I was recruited into the fellowship program of the Yale School of Medicine in pediatric endocrinology. Started that in October 2023, and here we are. I think the last few months of my fellowship training in PD endo.
So in the Philippines, you have completed a full pediatric residency equivalent?
Yes, that's correct. So in the Philippines, it's 3 years of pediatrics residency training on top of internship, which is part of the requirements for graduation from medical school.
Where did you go when you first came to the U.S.?
So when I first came to the U.S., I went to. You mean in
fellowship.
2020? Oh, for fellowship. So in New Haven, Yale.
So you spent a year there?
A year in New Haven for the Masters of Public Health program, and then the fellowship is also at New Haven, at Yale New Haven Hospital. So that's another 2 years and 10 months now.
So your first academic encounter was your MPH, which you do not practice medicine, and then you became a research fellow. Does that require a medical license?
No, the research fellowship for I think 3 months, from July to October of 2023, was my practical training extension from my Master's of Public Health. So it was purely research, non-clinical.
And that was on a J1 visa?
It was on an F1.
So F1 visa. So do
Yes.
you have a Connecticut medical license?
I have a training license, so
Training
it's a hospital-based license.
Understand. So it is not a permanent license. And I saw you took all 3 part of USMLE as well as FMG, and I saw your scores. They're very good. So now you're coming to South Carolina. What is your intent in South Carolina?
Yeah, so in South Carolina, I wanted to practice as an attending in pediatric endocrinology, and I have an interest in general endocrinology. So my training is primarily focused on type 1 diabetes. There's a lot of new things, a lot of new therapies. So I'm hoping to bring that to where I practice. And I also have been engaged during my training in medical education for the pediatric residents, for the medical students, for the junior fellows, and I think I'll be I could contribute to the medical school in that capacity as an assistant professor.
So you are, of course, you have a discussion with your chairman and dean sponsor your academic license. You are clear on as far as what you can do, what you cannot do, internal rules and regulation for academic license. So you will be working only with students, residents, medical student resident in a teaching capacity. Do you have any clinics that you will be participating in other than teaching?
Yes, I do. I do intend to hold clinic within MUSC.
But in a teaching environment, there will not be any private practice or anything outside the university teaching environment. Is that correct?
Yes, that is correct. No moonlighting and private practice.
Mr. Chairman?
Yeah, I can jump in and verify that. This is a 100% academic job that does involve seeing patients, but only in the academic medical center that is MUSC.
Do you have other academic license holder within your department?
Oh, tons, yes.
So you are familiar with the rules and regulations?
Yes.
And Dr. Wu would not be practicing independently or offsite on his own. This is purely for teaching only.
It'll purely be within the teaching hospitals that we have at MUSC, and it'll frankly be restricted to the Charleston campus.
What is the planned employment for him
Yes.
for the next 3
And
years?
So the American Board of Pediatrics is a little interesting. So we are willing to commit probably 5 years to ultimately be able to not only be able to ultimately be certified by the American Board of Pediatrics, both in general pediatrics and pediatric endocrinology. So it'll be a long process that we are more than willing to sponsor with the hopeful intent that this will be employment for many years after that.
I think you just answered my next question. So that the American Board of Pediatric will recognize the 3 years as a assistant professor and higher, and he will become eligible for board certification. And of course, that also will solve the permanent license issue. Now, Doctor, you have completed all the USMLE requirement as long as you have MG. So your area, that you did in Connecticut, would that also count as a certified fellowship for pediatric?
Mm-hmm. Yes. So the 3-year fellowship in pediatric endocrinology at the Yale School of Medicine is an ACGME certified program.
So what about your visa status? Will it convert from F1 to H1B?
So I am currently on an H1B. So I, for the first year of my fellowship, I was on F1, and then Yale New Haven Hospital sponsored my H1B for my second and third year of fellowship. And I think the hope is that we'll transfer the H1B over to MUSC.
I saw the expiration date was October, so the MUSC will sponsor you in that regard.
We have
Yes.
a contract that we're taking over. We're going to take over his H1B responsibility so that there's a seamless, there's no period where he's not sponsored.
Already. Yeah. Well, actually, that's all my question right now. I think our council brought up another issue, and our president, Dr. Wright, is going to ask a few more questions. Thank you.
Looking at your application now, as Dr. Chow was questioning you, it looks like you will complete 3 years of postgraduate education in this country in October of this year. Is that correct?
Yes, that is correct.
So at that point, you would be eligible for a permanent license after October 8th. So academic license between now and October, or certainly you would convert to a permanent license because you'll be eligible. Looking at your application, your training was ACGME from 23 to 24, 24 to 25, and 25 to 26, October. So October 8th, by statute, you would be eligible for a permanent license. So I'm just asking the chair also about the logistics. We there?
Oh, are you talking to me? Tipin, are you talking about the chair of the committee or
No,
who his chair is gonna
yourself.
be?
I'm sorry.
Oh, well, I mean, we would love that to be the case. The reason that we're down this pathway is that when Dr. Yu applied for the license, the licensure said that it couldn't be permanent and that we had to go down this pathway. So
But
this
yeah,
wasn't our choice.
they were correct that it couldn't, at the time, I guess you were applying, it couldn't. But now as we're looking at it, between now and October, not eligible for permanent licensure, but certainly eligible in October. Would that logistically work for you to apply for that license and start after October? Just to finish the residency, obviously.
Sure. Yeah, that was the overall, that was our initial plan. We were just trying to get the license so that, when his MUSC contract actually starts, that he'd be actually able to work. So, yeah, he's not actually able to work technically until he finishes his fellowship, which allows him to have credentials. Yeah, so he's, this is happening a little bit off cycle because he started in October instead of July, but it is in fact sort of the same as it's
Yeah.
as soon as they finish their postgraduate training, from our perspective, they are fine for a permanent license. So yeah, we guarantee that we're not going to employ him until the true completion of his that is, if y'all are willing to grant him a permanent license at that time, we would be delighted to accept it.
We will then be in touch with you. Our board administrator will be in touch with Dr. Hugh and yourself as to converting the request from academic license to permanent license with the provision that the residency program is completed on October 8th. These are complicated issues, and there's so many facets to look at. And, as we're going through this file and digging through it, we came on this. So, yeah, this will, it'll keep us from having to process an academic license and then convert it several months later when it won't even be used, to be honest, and you'll be much better off with a permanent license. So we will be in touch with you to convert it, and we appreciate your time today. All right?
Thanks very much.
Thanks,
Yes.
Dr. Yu. We'll let you know.
Thank you so much.
All right.
Good luck to you.
Everybody.
Dr. Wright? I think Dr. Wright, there may be another issue here dealing with his immigration status.
Hang on. Hey, are we off? On YouTube? Yeah.
Yannick, am I pronouncing it right?
Uyanık.
Welcome to the board. I understand that you're applying for academic license. Do we have the other individuals?
Yes, I'm here. Dr. Lockhart from MUSC.
Great. Good morning, Dr. Lockhart.
Morning.
Could Dr. Yak and yourself please turn your attention to the court reporter and follow her instructions so we can swear you in to give testimony?
Absolutely.
Good morning. If you could each just raise your right hands for me, please. Thank you. Do you solemnly swear or affirm under penalty of perjury to tell the truth and nothing but the truth, so help you God?
I do.
Thank you.
Hello, my name is Dr. Wright. Welcome to the board. I just wanted to ask you a couple questions about your training. I see that you received your MD in 2005, and then you did an internal medicine residency from 05 to 10, which is reasonable, and then you did a fellowship in hematology from 10 to 14, and then a bone marrow transplant fellowship in Turkey from 2019 to 21. What were you doing between 2014 and 2019? Practicing hematology or?
Yes, I was an hematologist in Turkey. I graduated from my hematology fellowship program in 2014, and I work in different academic institutions. One of them is Sakarya University, the other one is Okan University. And then I applied for a bone marrow transplantation certification program because we don't have a fellowship, formal fellowship program in Turkey. So it was a 2 years of certification program, but I was working as a hematologist and also a bone marrow transplant physician in that facility. So I worked as a bone marrow transplant physician for approximately 4.5 years in Turkey. Then I transited to the States.
Yeah, I noticed from 24 to 25, you were in Houston doing an advanced fellowship, and now you're at the Mayo Clinic in Jacksonville.
Yeah, in 2024, I was a leukemia fellow at MD Anderson Cancer Center, and last year I did my bone marrow transplantation fellowship at Mayo Clinic, Florida.
And from 2014 to 19, were you not just practicing, but also in academic institutions, and you were teaching?
Yeah, exactly.
Any publications or?
Oh, so many.
Okay, that's good. I'll turn my question now to Dr. Lockhart. You understand with an academic license that practice will be limited to the academic institution and involved with, teaching there, not doing private practice outside the academic institution.
Absolutely, fully understood. And that is the, we went into that with this understanding, and Dr. Yanik has that understanding as well.
And what does Dr. Yannick add, like his expertise?
As you can see from his training background, he is, he had already bone marrow transplant training, in his home, and then he came here and did additional training. We are, cellular therapy is becoming more and more a prominent part of the treatment for malignant hematology conditions, but also solid tumor conditions, including melanoma and some sarcomas, and with more to come. And so it is an expanding part of our portfolio and our footprint within South Carolina, is offering cellular therapy, some of them with curative intent, to patients with those conditions, and and not to mention things like gene therapy for sickle cell anemia and those kinds of things. As part of MUSC's growth, we're seeing more and more of these patients, and we have a new hospital planned in 2030. All those things coming together, so we do need additional faculty to add to the team, and then Dr. Yanik has exceptional expertise and exceptional training, and I think would definitely enhance that. In particular, he's going to be focused on the treatment of patients with multiple myeloma. We use a lot of cellular therapies in multiple myeloma. Multiple myeloma is the most common hematologic malignancy in South Carolina, and right now we only have one physician who's focused on that area at MUSC, and we could use probably 3 to 4 total. And Dr. Yanik will be the second person on that team, and we're still recruiting for others.
Thank you. The other question I have is, he'll have a rank of assistant professor or higher.
Correct.
And is there a pathway that you're looking at for permanent licensure for Dr. Yanik eventually?
I believe that once he has served, I believe, I think just even 2 years on faculty, he should be eligible for board certification.
Yeah, that's correct, and we'll work through that as long as you have that plan.
Yes.
I have any other further questions from any members of the board? I'd like to make a motion for the board that we proceed with academic licensure for Dr. Yanik. Is there a second? Second, Dr. Chow. All those in favor? Any opposed? Dr. Yanik, thank you. We'll proceed with your academic, and we wish you well, and thank you for serving our communities. And thank you, Doctor.
Thank you.
Thank you so much.
Oh.
Bye-bye.
I'm not an internist, but I do know that the American Board of Internal Medicine has been working on an alternate pathway for foreign medical graduates to become board certified in the United States. And I don't know all those requirements, but I understand it's something fairly new, and it may be something you would be interested in checking into if you're board certified in this country.
Yeah, there is a pathway A. If you stay as in an academic position for 3 years, you can move forward with the board certification.
Already checked into it.
Yeah,
Okay,
exactly,
all
yes.
right. Good luck.
People like that.
Off. All's in favor? Okay, we are now in open session. This is Dr. Victoria Fernandez, request for academic license. Dr. Fernandez, can you hear me?
Yes.
And I see you have, who's on the line with you?
Yeah, hi, this is, I'm Andrew Eisman. I'm the chairman of the Storm Eye Institute, the ophthalmology department at MUSC, where Dr. Fernandez will hopefully be working.
Okay. Could you both turn your attention to our court reporter? You can see her, and she's going to give you some instructions to swear you in for testimony.
You would each just raise your right hands for me. I'll swear you in. Thank you. Do you solemnly swear or affirm under penalty of perjury to tell the truth and nothing but the truth, so help you God?
Yes, absolutely.
Yes, absolutely.
Thank you.
Dr. Fernandez, one of our members, Dr. Gregory, is going to ask you some questions. There might be some follow-up questions for yourself. Are you're the chair that you said there?
Yes, sir. I'm the chairman of Storm Eye
Okay.
Institute, which
I
is
just
the
wanna
ophthalmology department. I'm here to represent both
Sure.
the department and MUSC for Dr. Terry Steyer, the dean.
Well, we're going to start with some questions from Dr. Gregory to Dr. Fernandez, then there may be some follow-up questions for yourself or other members of the board.
Thank you.
Good morning, Dr. Fernandez. I would like
Good
to
morning.
ask you, over the last year, you've been working at MUSC, is that correct?
Yes, I've been doing some research, actually a lot of research in the Department of Cataract, Cornea, and Refractive Surgery
So you haven't been
with
seeing,
Dr. Caroline Rocha. Sorry?
okay, have you been seeing patients over the course of the last year?
No, it's just clinical research, but no patient relation, no.
Okay, could you just briefly, for us, go through your medical education and training?
Yes, so I've graduated medical school in 2017 back in Brazil. I've done most of my training in Brazil. So after that, I've done my ophthalmology residency in Belo Horizonte, is the city actually where I grew up. After that, I went to São Paulo to do a 2-year fellowship in glaucoma surgery and clinical glaucoma. And after that period, I actually did a refractive surgery fellowship in Belo Horizonte, and that started between 2024, 2025. In between that, I've always liked research, so I've always been involved with research. I've had some couple of opportunities to be in the U.S. So I've done 2 clerkships while at medical school in the U.S. So I've been to Icahn Medical School at New York. I've been to Yale. So I've been to a couple of institutions, Columbia. I've always been evolving and trying to actually be involved in research and trying to always learn. Yeah. And then now, the last year and 4 months, actually, I've stayed here at MUSC doing some research in the department. Yes.
And your role moving forward, when you get this license, are you going to start seeing patients in the clinical setting, or are you going to remain mostly in research, or is that going to be a work in progress?
Yeah. Yeah. So the goal now is to a clinical position. That might be some research involved, but it's mostly to see patients get back into clinical practice. Yes, especially in the glaucoma sector department.
And will you primarily be working in the Charleston area?
Yes.
Is it okay if I add a little context, or?
Yeah. Thank you.
Oh, thank you so much. Yeah. So thank you so much for really, having us here, and for me to sort of advocate for Dr. Fernandez. I've been the chair now for a little over 10 years, and Dr. Fernandez's training is really outstanding. She's board certified in Brazil, actually already has some glaucoma, a significant glaucoma skill set. She has been out of clinical medicine for, a year, 16 months or so. But we feel very confident that she'll be able to regain that, especially with our mentoring and our supervision, as we know is required for an academic license. And the first year here with us will be actually sort of retraining in glaucoma, and she's actually going to be a glaucoma fellow under the tutelage of Dr. Jella Ahn, who's an internationally well-known glaucoma specialist. Excuse me, and I think that's going to be a great opportunity for her, but it also will expand access for our glaucoma patients, and that's really one of our number one issues. There's so much glaucoma in South Carolina, and we only have 2 glaucoma specialists, and so having this fellowship position really significantly expands our ability to care for the folks in the Low Country and really throughout the state as well.
Thank you very much.
Your motion, Dr. Gregory?
I'd like to make a motion that Dr. Fernandez, we move forward with her request for an academic license.
Is there a second? All those in favor? Any opposed? No opposition. Well, Dr. Fernandez, your administrator will be in touch with you as proceeding your academic license, and we wish you well. And also would counsel you on moving towards a pathway for permanent licensure. And there are certain pathways if you hold an academic rank and a number of years that you do. So I would encourage you to reach out and work towards permanent licensure in our state. And we welcome you to serve our state and our community. Thank you.
Thank you so much for having me.
Thank you so much. Really appreciate it. Have a great rest of the day.